Hey there, and welcome to a new year of our UTMB Health Corner with Houston Moms and our partnership with UTMB Health, our preferred providers in the Bay Area, League City, Galveston, all of you Southeast folks. You've seen us here, and it's a new year, and we're ready to bring you new and important information to your household. Today, we are talking about something that is a little bit of a hard topic, but very, very important, especially in January in these months. We are talking about something called perinatal mood and anxiety disorder, which we used to commonly refer that to as PPD back in my day, but we are getting some new and updated information from a clinician at UTMB Health to shed light on this topic, what you need to know, what you need to be aware of, and what resources are out there to help. So today I have with us Souby George. She is a nurse clinician with UTMB Health, and this is her passion project. So Souby, thanks so much for being with us.
Thank you for having me.
Yeah, absolutely. So tell us a little bit about you and your practice and where you practice.
I'm Souby George. I'm a nurse clinician 5, work UTMB Mother Baby Unit. I've been there for the past 17 years. Um, and I also adjunct for School of Nursing as a clinical faculty. My passion for this started when I had my daughter. The experience I had after I had her. She's 20 years old. So I always heard about postpartum depression. That was the term we always used back then. And I remember my nurse telling me vaguely about watch out for depression. So I was like, oh, okay. Um, I sure watch out for depression, but I never had depression. Mine was all anxiety. And also, I want to say OCD. I was like thinking that something is bad going to happen to me. And
Mhm.
this impending doom. It's always this fear if something going to happen were to happen to me, what am I going to do with my daughter? How would she even know me as a mother? Then my compulsion was I was like, I started writing things. I had this journal. I started writing in detail, who I was and what kind of person I am. Then I want her to know me. So it went on for a long time, and I have a separate journal that I kept other than what I've shown people, the photo albums and stuff. So 6 months later, I had a major panic attack. I went to an emergency room. They diagnosed me with hypertensive crisis. Looking back, that was not a thing, but no one ever put two and two together. They never thought, oh, she just had a baby 6 months ago, you know.
Mhm.
So there's a big gap, and I'm hoping that was 20 years ago. So
Yeah.
we come a long way. So we are screening now. We are asking our moms, we are, like if they're experiencing any of these symptoms, then we have help available. So, but my experience was I was alone.
So
And
this set you on this path. And so let's kind of back up a little bit because you mentioned 20 years ago. I gave birth 14 and a half years ago. So again, it was like postpartum depression. That's like the only thing I knew to call it. You mentioned anxiety though, which is why we're calling it perinatal mood and anxiety disorder.
yes,
Do we say PMAD? Is that what we're
PMAD.
calling it?
Yeah, yeah, we call PMAD. So it's
PMAD.
perinatal mood
Okay. And
and
so explain what that encompasses. Um, besides just like your like depression.
so, like I said, like the common term was postpartum depression, and that's the only thing we were concerned about or thought about back then.
Mhm.
Um, but later we did realize that's just not it. Our women suffer more than just depression. We suffer from anxiety. It could be an OCD. You can have an underlying bipolar mood disorder. That triggers a lot of other cascade of events. You can have past trauma from previous pregnancies that can trigger a lot of the bad experiences and bad memories from the subsequent pregnancies. Um, You could have psychosis, which is very rare. 2 in 1,000 go through it, but still that's that's there. Then of course we have our postpartum blues, which is very common. 85% women go through it, which we trying to normalize it, you know. So you OCD on top of that, you have obsession and compulsion. Some women have everyone has a little bit of those, but some have extreme that they just cannot shake it off.
So
So
I was reading an article, I think, and we'll make sure to post this below, it was from UTMB Health, that 1 in 5 women
mhm,
will experience some sort of PMAD. Is that
yes,
correct?
yes. So when I first started talking about it, it was 1 in 12. The first PSI conference when I attended, um, that we were talking about 1 in 12. Then it became 1 in 7. Now it's 1 in 5. So we are screening more. People are more open to it. They are saying, "Oh, I have a problem. I need help." But back then, I guess we were hesitant, and no one actually asked. My doctor, when I walked in, she said, "You look good," and I probably did look good from outside. Then I believed that, oh, if she said I look good, I must have looked good.
Yeah.
There was
So
no
what
other
are y'all
conversation.
doing differently? So if 1 in 5 are, and let's say that's a conservative side, are suffering from some instance of PMAD at any point after, their pregnancy, what kind of screening questions are you asking? What does this look like when you go in for, is it happening at the 2 week checkup or the what, like, remind me of what the checkups look like. And is it 1 week, 6 weeks? I remember like a 6 week release, and that was basically just so I could for the little children in the room, but I could go home and have sex, right? Like that was the 6 week checkup. There wasn't a whole lot of like worrying about me kind of deal.
Right.
Um, so what do those stages look like?
So we do screen before they leave. So 18 hours postpartum, we screen all our moms, which is mandatory that we have to do it. And if they score certain score higher, we have to have a social work consult. So we send them home with all the resources. And if they have like a higher score, especially with the APDS, the number 10 is self-harm. If they score anything other than 0, that's an automatic trigger. Like we just escalate it pretty quickly. So
So
psych
are these being given, like, is it given orally? Or are these forms that we're having the patients fill out? What does that look like?
they fill out thinking about what they experienced, how they felt for the past like 1 week. So that's the window. The
Okay.
past 1 week, how were they feeling? Not
So
the 2 months before, 2 years before, just the past 7 days.
got it. Okay. So here's the thing that I think a lot of women do. I know I'm guilty of it. You yourself said that a doctor said you look good, so you must be good. What would you tell a woman who, especially if she's about to give birth, about how important it is to fill out those questionnaires honestly and be truly honest? Because I think where we get stuck is kind of this we don't want to be judged. We don't want to like, we just brought life into this world and we're a happy family and we should be grateful and all of these emotions, and it doesn't feel like we should be worried about us. What would you tell that mom who is going to fill out that form as to why it's so important to fill it out truthfully?
The one other reason I'm sitting here and talking to you, that's the reason. Because if you need help, it's okay to ask. Asking help is not a sign of weakness. You are a strong mother. You want to be there for your baby and you want help. You absolutely need to seek out. And that's nothing wrong with it. You being a present mom, mentally present mom, is better than not one having at all. So
Hmm. You deserve the help.
you deserve the help. And help is there.
Yeah.
We are trained professionals are there to help you. So it's not like before. You're not going to be judged
And
because
I think that's why it's so, so important to have these conversations because the more that we talk about it, the more that we normalize it, the more that people are not afraid to speak up about it. And in fact, we'll drop a couple of blog posts that my team have written over the years about their struggle. We may have to go back and rename it because they're all PPD. But we can talk about PMAD in a very honest way. And I think the more that we speak about it, um, the better outcomes it's going to be for, not just the mom, but the kids and the family and the whole dynamic system. So you talk to resources and like what that means. So what kind of resources does UTMB Health have for moms who are on the edge of struggling or they're in the thick of PMAD?
yeah, we have our social workers. They come around, care management team. They are trained, so they come around and talk to these moms. Also, if they need any extra help and more like a medication, we have psych department. They're excellent coming around and helping with us. Also, we have resources outside. We also have a national maternal mental health hotline. If you have any, you can just reach out. So they will listen to you, what you're going through. They connect with the local support group or organizations. They refer you to our health professionals if you need more care. So you can call or text the number. Um, and they have interpreters for more than 60 languages to help you if you don't speak English or Spanish. So the good thing is you can call or text. Most of the time, our moms, when they are depressed, they really don't have no energy to just call. So mostly, at least nowadays, everybody prefer texting. So that's an option. Um, we will provide you with all the information, but it's a national mental health, maternal mental health hotline. So 24/7 available.
Okay. And we'll be sure and drop that information below as well. And so kind of what we've talked about is a lot of kind of like the like initial postpartum, but you mentioned that yours came, or at least where you're finally at like what, like a 6 month mark. Um, who do we need to be talking to if we're getting to we're 4, 6 months out of, pregnancy, but we're still feeling funky bluesy? Maybe more than just the baby blues. Like we should be kind of a little bit beyond that. Who
Yes.
are we talking to at that point?
You can always reach out to OB or your primary care provider and reach out to this hotline too. Anytime. You don't have to be diagnosed with anything, for you to reach out.
No,
We'll just
I
go
think
from there.
that's so important. And something that we always stress on these videos with UTMB Health is how important it is to have a established relationship with either your OB or primary care physician so that
Mhm.
if any of things come up that you have a relationship, you have a kind of a camaraderie that somebody knows you and that you don't feel alone and they have kind of like a before and after window of you.
Yes. And
Excuse
also,
me,
I
but
think now lately, what I'm seeing is like when I pull up patients chart, it says like recently pregnant. So that kind of flags you if you go to any UTMB,
Mhm.
um, clinics or anywhere. I'm hoping that's something that it gives you she just had a baby. Maybe it's because it's connected to that.
Yeah, and I
Not a-
think
or
I
that one.
always notice when I'm filling out those forms, it says like any big life changes. Um, and I think pregnancy and birth would be one of those big life changes. And it could even be like maybe you had like a pregnancy that did not end in a live birth. And so, I mean, there are a multitude of reasons you could go through all of this. Any other resources or anything else you would like to share about PMAD with our audience?
Postpartum Support International, they are very big on this. They're leading, the group is actually leading the whole movement in the United States. So they have excellent resources in there too. So I will share that with you too. So they have support group for dads, support group for moms, and different situations, laws. They have, I mean, they have excellent resources. So we'll definitely share that.
Perfect. And we will pop that in the comments below as well. I think it's such an important topic and one that we should not have fear in sharing about. And that we are trying to make this more of a normalization where providers are comfortable, that you're comfortable as a patient to be like, hey, I'm not feeling my best. We want you to have that confidence that you are not going to be judged as a mom or the type of mom you are. And in fact, I would say it makes you a pretty darn good mom. When you know that you maybe need a little bit of additional support and help. And I think it's incredibly important. Souby, I know that you lead the charge over there at UTMB Health, and we're incredibly grateful for your service to them and to the team over there. If you need a primary care physician or if you need somebody in the OB department, if you're currently pregnant, we have suggestions for you. We're going to pop a comment below that also has how to find a doctor at UTMB Health and someone that you can trust and support. Again, we'll put all those other resource comments below. If you have any questions about PMAD, please ask them and we will make sure that they get answered. And we'll also put in some supporting blogs as well so you can be educated, whether it's your first, second, third, fourth, fifth pregnancy. We appreciate you joining us in this new year with a new video from UTMB Health. We'll be back next month with another informative health video. Until then, we'll see you. Thank you.